Hey y'all, it's great to see so many folks join us on here today. We're going to get started so we can get to as many questions as possible. First, I want to thank Dr. Traxler with DHEC and Dr. Schur with MUSC for joining us today and offering your knowledge and all of your expertise. COVID-19 is still a very serious threat to the health and safety of South Carolinians. And I know there's going to be a lot of questions directed your way today. We've had over 60 questions that have been pre-submitted by folks in the audience. So we're going to tackle some of those first and then hopefully take some questions live, assuming we all have time. Before we begin, though, we've received a lot of questions regarding the current status of COVID-19 relief legislation in Congress. So I just want to give you a quick update on what's happening, and then we'll get going. Since Congress has allowed key COVID-19 relief measures to expire, I've consistently pushed leadership for another bipartisan package. And with so many South Carolinians still out of work, small businesses struggling, and then on top of that, our state and local governments on the edge of a fiscal crisis, it's clear that more legislation is desperately needed. And I've repeatedly called on congressional leadership to stop the partisan political posturing and come to a compromise. And that's why I joined a bipartisan group of my colleagues in the Problem Solvers Caucus, 25 Republicans, 25 Democrats, to include a bipartisan framework designed to essentially kickstart the relief negotiations. That was by and large successful in bringing folks back to the table. President Trump and several Senate Republicans spoke favorably of our framework, and there's been some promising reports of a potential deal between the Speaker and Secretary Mnuchin. But look, inaction is not an option. While President Trump pulled out negotiations earlier this week, he seems now they may support a comprehensive package, and negotiations between both sides are still ongoing. So I'm cautiously optimistic that we can get a deal, and I hope that both sides understand what is at stake here. Low country families and small businesses are struggling right now, and quite frankly, we can't afford any more delays. We can't turn our backs on them, especially when we know a deal is possible. So I'm urging both sides, including the president, to remain at the negotiating table and deliver some much needed relief. With that, our first question is from Sarah. Sarah asks, are there plans or protocols being put in place, including more resources supporting public health for if and or when another pandemic hits, so that we're better prepared for the future? That's a great question, Sarah. I think it's imperative that we learn from 2020 to never find ourselves in the same place again. And I'm committed to working with my colleagues in Congress to ensure that there's a streamlined national strategy in place to deal with future pandemics, similar to what was in place under the previous administration. I'm also committed to supporting our frontline workers. So I supported $16 billion in funding in the CARES Act for PPE and the other critical supplies for our healthcare workers. Dr. Traxler, you want to touch base on what the state is doing to improve on responses in the future?
Sure, and thank you, Congressman. So we are continuing to build off of what we already had in place, what we know from prior experiences, prior smaller pandemics, to know works, such as from the H1N1, a lot of lessons learned that came out of that. The vaccination planning that went on for that pandemic has carried over to this one. And we continue to. The state is already working multiple agencies together to have some of our own resources, physical resources on standby as a stockpile, similar to, what the federal strategic national stockpile, and to make sure that the plans and the coordination and so forth are in place, is, just building upon what was already there and continuing, where I think we're all dedicated to continuing to maintain these strong relationships and coordination.
And Dr. Schur, do you want to comment on what resources are needed to ensure that our frontline workers are prepared should this happen again?
Yeah, I agree. The coordination piece is key. As you know, it does take an incredible amount of PPE to keep our healthcare workers safe, and just to make sure that there's a coordinated approach to the supply chain, so that we're not competing against each other instead of working with each other. But yeah, it's primarily around PPE.
Our next question, I think is regarding small, next steps for small businesses. Broderick Christophs asked, with time running out for many small businesses, what's the status of the current bipartisan group that's working on getting the agreed upon parts of stimulus passed, specifically the PPP second draw? Thanks, Broderick, for that question. Since day one of the rollout of the PPP program, it's been a lifeline to thousands of small businesses across the low country. So much so that, back in the summer, Congress infused a second round of funding and some increased flexibility within that program. And as I mentioned earlier, I joined my colleagues in the Problem Solvers Caucus to lay out the bipartisan framework for the next round of stimulus. And I support providing the small businesses that need it with a second PPP loan and allowing them to spend these funds on protective equipment and testing expenses, open up some flexibility. I also know that initiatives like the PPP have not been as helpful to the commercial real estate market. And that's why I support legislation that would establish a lending facility to help the commercial real estate industry stay afloat, help them avoid foreclosure, keep their employees on staff, and emerge intact on the other side of this crisis. I'm confident we can get both sides back to the negotiating table. We can find some common ground on relief for small businesses, including a second round of PPP and an expansion of the program to include the small businesses that were left behind in earlier rounds. So there's another question regarding testing, and it's from Sharon. She asked, is there a place to be tested to see if a person has already had COVID-19 without symptoms? If so, what is the cost? It's a great question, Karen. My office receives regular calls from folks still confused about where, how, and when to get tested 7 months into this pandemic. So I joined my colleagues in passing the Families First Act, which ensures free testing for COVID-19. Dr. Traxler, Dr. Schur, y'all want to expand on Sharon's question as far as the specifics?
Sure. So our DHEC website has places where you can get tested for current illness. And so I do want to make that distinction. Those are looking at those PCR, the swab, or the saliva tests. And there are some, though I don't think we have them listed because we don't necessarily know where they all are. Some places are starting to get the rapid antigen tests, but again, these will diagnose current infection. If you want to see if you had it before, you would need an antibody test, which is a blood test, either drawing blood or pricking your finger. And there are ones of those out there. The cost would vary, I'm sure, depending on where you go to get it. I do want to caution folks that if you go and you get tested for antibodies, not to assume then that you have protection because we don't know for how long you might have protection. We don't know if there's a certain level of the antibodies you would need in your bloodstream to be able to protect you. So it doesn't mean you don't need to wear a mask and do the social distancing and all of that. But I also know if you go to donate blood, many of the blood donation facilities in South Carolina are screening for antibodies. So you can find out if you've had exposure before and do a good deed by donating blood that's desperately needed in our healthcare systems.
And just to follow up on that, that's a great point. Yeah, the blood donation centers do test for antibodies, so that's one way. The MUSC Health also offers serology testing through our virtual urgent care platform, so you can access the platform anywhere in the state, so musc.care, and then we try to connect you with a site that draws blood. And thank you for Dr. Traxler for all those key points. We don't. If you have protection today, it doesn't necessarily mean that you still have it tomorrow, and it certainly doesn't preclude any of us from, all the, the usual, social distancing, hand hygiene, and face mask wearing. So, but hopefully that's helpful. There are, dozens of sites around the state that do robust serology testing.
Thanks, Dr. Schur. And it's important that if you have had it, your plasma can be used to treat other people in need. I think when I donated plasma, I think they told me it went to as many as 3 COVID patients to help as many as 3 or 4. So that can be a big help if the event that you've had it and you're beyond the waiting period in which you can donate.
Yes,
it's another good way for people to help out. We've had several questions submitted with concerns that still exist about the safety of loved ones in nursing homes across the Low Country. Sally, whose father passed away from COVID-19 in a nursing home, asked what additional oversight has been put in place in assisting living in nursing home facilities since the pandemic hit. And Frederick asked, what's the plan for testing outreach for the elderly who reside outside of nursing homes? First of all, Sally, we're so sorry for your loss, and our thoughts and prayers are with you and the other 3,300 families who've lost a loved one to this virus in South Carolina. It's undeniable and tragic that our seniors have been some of the hardest hit populations of this pandemic. I don't know, Dr. Traxler or Dr. Schur, if you want to speak on the updates on nursing homes and the outreach for our seniors.
I can speak on nursing homes, and if Dr. Schur wants to talk on testing, but we did put out new guidance today. Actually, I have not checked to see if it is actually up on the website or if it's in the process of going up, but you might be getting a sneak peek by me telling you this, but we do have new guidance going up today that is in alignment with the CMS guidelines that they put out a couple of weeks ago. And so it's gonna hopefully make visitation more accessible, but also safe for family members to get in to see their loved ones outdoors, and then and when it's appropriate, indoors as well. And we've worked closely with the governor's office, and also I did as a member of a task force led by the Department of Aging. It had a number of representatives that worked on this. So we really hope it should increase visitation ability when it's safe, and where it's safe, and how it's safe for family members, because we recognize that a lot of folks have gone a long time without seeing their loved ones in person. And we know that's difficult.
Yeah, that has been such a tricky balance, is, maintaining compassion and, having loved ones in close proximity with each other, which is, very, a compassionate approach to care, but also balancing the safety of our most vulnerable patients in the state. So that has been very tricky. MUSC does own and operate 2 nursing homes, and we have really, struggled with that very fine balance and threading that needle in a way that keeps everyone safe, but also, their own, balancing their own personal needs to be around their loved ones. So it's been hard to watch, and certainly hard to balance those needs. For community testing, so for those not in there, so for the most part, so most nursing homes, and Dr. Traxler, you can clean me up on this, but they have been afforded rapid testing, so they can test their residents and staff at intervals depending on the prevalence of the disease in their community. So that's great. That's a huge win for the state and the nation, frankly, to have that rapid testing available. And then for those not in nursing homes, so for we have a whole variety of at-risk community testing sites. All of those sites, the intention is to have at least every county have at least 1 testing site every single week. And all of those sites are listed by, date, time, location on the DHEC website. So we do have vast numbers of what we call pop-up sites or at-risk community testing sites available through the DHEC website.
And I know Gene asked about on the chat box about the types of testing. Can you all explain the types, the differences, and reliability of different tests?
Go ahead, Dr. Scherer.
I'll be happy to give it a start, and you clean me up if I miss any details. But I think the easiest way to think about it is there is a single gold standard test, which is what we call PCR. So it detects the genetic material of the virus. The only problem with PCR tests is that they need to be run in high complex labs. They're expensive. It requires transport of the sample. So typically the patient at hand is not near the centralized lab, and we don't have that many highly complex labs in the state. So we end up transporting samples long distance, and that it makes the turnaround time go up, which nobody wants, et cetera, et cetera. Having said all that, that is the gold standard test. If you have COVID, it usually detects COVID at a very high sensitivity. And if you don't have COVID, it tells you you don't have COVID. So it's both sensitive and specific. It's a great test. But again, the limitations are it's costly, it's invasive. So it's typically that what we call the nasopharyngeal swab. And the turnaround time varies depending on how far away you are from a highly complex lab. Because of that, there's a whole variety of less invasive collection types, such as nasal swabs and saliva, as well as what we call point of care tests, which test at the point of care. So these are much smaller devices. As I mentioned, many of these devices have been deployed to our nursing homes. They are convenient, they are fast, they are easier to collect. So there's a lot of bonuses, but they are not the gold standard test, and they will miss some positive patients. So that's what we call the sensitivity of the test. So what's probably most helpful is if you're getting a test, if there's any way you can ask in advance, what is the sensitivity of the test or the accuracy of the test, then that'll help you interpret for you, your family or loved one, how to interpret a negative test. That's kind of the high level overview. There's hundreds of tests on the market, as we all know, but that's kind of the big picture overview of testing.
Awesome.
And I don't think I have a lot to add. Dr. Shearer is right. A lot of our nursing homes and some of our assisted livings have received these, the more rapid PCR tests. And the state got, I believe, I think 15 of those. And so actually a lot of those went to hospitals, jails, long-term care facilities. But there's not been an abundance of the supplies needed to continue to run them. And so that has been a struggle. More recently, the nursing homes and assisted livings have gotten either the machines for the rapid antigen tests or the actual cards. You might have heard about the Binex Now cards from Abbott. But as to the machines, they're antigen machines. Again, there's back orders for the supplies needed to continue to test on those machines. The Binex Now cards, are just now coming out. We're just now learning a lot about them, but they have the potential, if they're accurate, to really be very useful.
Awesome. That's really helpful. Ralph has a question about the fall wave. He says, I'm really worried about the high levels of virus spread in South Carolina as we head into the fall and winter where things could get worse. He says, it's crazy to me that the state is fully open with low restrictions and our personal positive is still in double digits. He asked, what can be done to get this under control? And he asked whether or not widespread asymptomatic testing can be rolled out. Appreciate the question, Ralph. I'll say what I've been saying since the early days of this pandemic. Please wear a mask to protect not only yourself, but your neighbor, your family. I was proud that an overwhelming majority of the Low Country's local leaders stepped up to the plate this summer and implemented local mask mandates. It's undeniable that this has made a difference. Dr. Shearer or Dr. Traxler, you want to chime in on Ralph's question on what we're looking at come this fall or winter?
Yeah,
sure. Go ahead.
I think the biggest concern is, typically in the fall and winter months, we do see a lot of respiratory virus illnesses, and they're going to be hard to distinguish between COVID and non-COVID. And so we're going to have to end up doing a lot of testing to try to discern, is it flu? Is it, just a run of the mill cold? Is it, is it COVID-19, et cetera? So I do think we're going to see a lot of patients that have symptoms that are going to require testing. So I do think testing capacity is going to become more important than it even ever has to date. I totally agree with you that, wearing face masks makes a huge difference, because if you are asymptomatic and you're wearing a mask, your likelihood of transmitting that to another person is very, very low. So I think face mask, policy and enforcement is going to become extremely important, particularly in the fall season. If we do this well, we may actually see lower rates of respiratory viruses than we otherwise would. So some of that panned out in other countries where they had really good policies and protocols for social distancing and mask wearing, and that their flu season was below average. So in some ways, we may actually have us be better off than usual for the typical fall and winter season if we do this well.
I do want to say, though, that's not a reason to not get your flu shot. That is one thing I have heard recently is, well, we're wearing masks and social distancing. Maybe we don't need flu shots. And I will tell you what I told my own family, which is this is the most important flu shot of your life, most likely. We do not want to overwhelm our hospital systems with all these respiratory viruses and flu virus patients and then COVID patients as well. And as Dr. Scherer was talking about, it can be difficult to diagnose with the symptoms overlapping. So please get your flu shot this year, and then continue to do those other things that we know work against both COVID and the flu, the mask wearing, avoiding large group gatherings indoors, that sort of thing. And hopefully we'll get through it without it being significant.
Yeah. Shifting gears a little bit, Mark's got a question about unemployment. He says unemployment statistics are at record highs. He says that many Americans who have been laid off due to COVID-19 are no longer or shortly will not be receiving unemployment compensation. What can be done for them? He says his daughter, divorced single mother too, is in this group. Thanks for the question, Mark. You know, our country has not seen this sort of devastation to our economy and loss of jobs since the Great Depression. And now that's why back in March, I joined my colleagues to pass extended unemployment benefits to those who lost their jobs due to COVID-19. And while this has expired, the South Carolina Department of Employment and Workforce has begun distributing the additional $300 in lost wages that the administration implemented last month. It's very clear that the economic damage from this pandemic is not going away anytime soon. And I'm committed to working in a bipartisan fashion to provide relief to those who need it and stand ready to hop on a plane back to DC as soon as I get the green light from congressional leadership that a deal is done. In the meantime, though, Mark, if your daughter or if anyone on this call is experiencing issues with their unemployment benefits, please call our Mount Pleasant office. And that number is 843-352-7572. We've helped hundreds of constituents navigate and receive the benefits that they deserve during these challenging times. Cheyenne's got a question. She asked, are there any new plans for the virus now that we know that the new mutation is more infectious than the last one? Dr. Traxler and Dr. Scherer, you all want to speak to this and about the latest science of COVID-19?
So I think from what we know about the various mutations that may be out there for this virus, it still comes back to those same infection control principles that we know work. And work really against even these different mutations. And that's the wearing of masks, staying distances apart, at least 6 feet, avoiding big group gatherings, especially indoors, doing good hand hygiene, wiping off surfaces. But really, we know that all of these are spread person to person is the biggest way. And so taking measures to decrease that spread, regardless of the mutation of the virus, will certainly be a big benefit.
And I imagine, what the question, so many people are wondering too, I don't know if y'all have any updates on the status of a vaccine, if there's anything y'all want to add there, what's developed, if anything, recently.
I mean, as you know, there's dozens of companies pursuing this. There are some front runners in phase 3 trials, which means that they are in the phase of, large scale human trials. Most of the vaccines that are being done by reputable companies that are further down the road are requiring 2 doses. So that's probably something that's extremely likely for us to prepare for. Many of the vaccines are also going to need to be stored, refrigerated. So that's another sort of logistical thing to think about, like how are we going to get vaccines to people in low resource areas, et cetera. As far as the timeline, I do think the FDA, from my understanding, has stood their ground on the monitoring and safety and efficacy end of the vaccine trials, whereby they are going to require at least 60 days monitoring period post the last, second set of vaccines in all of their participants to make sure that it's safe and effective, just like we would with any other vaccine. Having said all that, that does make a 2020 vaccine release look pretty unlikely, to be honest. Everything seems to be up in the air, but as I stand here today, it does look like it is unlikely for 2020.
we're being prepared. We're getting our plans in place statewide. We're working with all of our partners to be prepared when it is available. The CDC and the federal government had asked that states basically, I guess month or two ago, asked that everybody be ready by November 1st in the event there is one. And so we are making those preparations and planning as needed. As Dr. Scherer said, some of the challenges with this will be that a lot of them do need a second dose, and it has to be the same type as the first one you got. And also some of them have to be kept ultra cold, not even just refrigerated, but minus 80 degrees Celsius. But we're making all those plans. So whenever it is ready, South Carolina will be ready.
Shifting from physical health to mental health, which is something that should be getting more attention. Michael asked what mental health resources are available as part of the COVID relief and economic stimulus. And it's a great question, Michael. I mean, it's been over 7 months of living in this pandemic, and we've been stuck at home. We've lost the ability of physical contact with loved ones, we've lost jobs, and worst of all, over 210,000 Americans have lost loved ones. And this takes a real toll on us all mentally. And one way I've personally combated this is coming to these challenges is get outside and enjoy all the beauty the Low Country has to offer. Whether it's taking my dog Teddy to Sullivan's or Isle Palms for a quick jog, or out to James Island County Park. And we recently passed, and the president signed into law, our bill, the Great American Outdoors Act, which permanently authorizes funding for parks and outdoor spaces to ensure that our most beloved outdoor spaces are protected for generations to come. So that's one channel. Obviously, Dr. Scherer, Dr. Traxler, you want to speak to what besides getting out and about parks, what other resources may be available for mental health in Low Country here today?
Sure, we recognize too that this really has taken a toll on all of us. So give each other a little grace, as check on each other. But also the Department of Mental Health for South Carolina has some great resources available on their website that are available statewide. So their website is scdmh.net. That's scdmh.net. And they have some great resources on coping and techniques for this.
And I'll just a little more detail for the MUSC health side. Obviously, we have a full spectrum of mental health services available, and all that's also available on our website. In particular, depression, anxiety, and for all age ranges, literally, 0 to 100.
Thanks for that. There's been a lot of questions on tourism and businesses reopening safely. Carol submitted a question. She asked us if it's best to discourage tourists from visiting Charleston for holiday decorations this year. She said she's afraid that COVID is not going away for Christmas. Carol, thanks for that question. I mean, Low Country, is internationally known for our hospitality, and just this past week, Charleston was rated for the 10th year in a row as the best small city in America. And Hilton Head Island was rated the #1 island in the country for the 4th year in a row. So look, the secret's out, and people want to spend their time visiting our coast and dining in our restaurants. And that's a good thing. I mean, tourism and hospitality are the #1 drivers of our economy down here in the Low Country. And conversely, the first industry that was devastated here when the doors were closed due to COVID-19 this spring. So, Carol, I understand your concerns about the safety of visitors coming to our area, and I recommend that everyone patronize our local small businesses in a safe manner, wearing masks, practicing social distancing. I've been proud to see our hospitality industry at the forefront of ensuring safe guest experiences at their places of business, based off of the guidelines set forth by CDC and DHEC. I don't know, Dr. Traxler and Dr. Scherer, you all want to weigh in on how we can stay safe this holiday season, especially as more people come into town, or more people get out and about and enjoy our local restaurants.
I think you hit the nail on the head there with saying it comes down to these same protective mechanisms that we do. You just need to be extra diligent about them when there are more people out and about, doing the social distancing and mask wearing. Try to go out and about, maybe do your shopping when it's the less peak times, not when it's the most crowded. We certainly still want to be supporting those businesses, for ones that may have online availability, that's something you can look at. One nice thing, we're blessed with nice weather, warm weather throughout the year in South Carolina. And so certainly outdoors is better than indoors. So, to the extent you can maybe have gatherings, if you really need to have a gathering, do it in a large outdoor space so people can spread out well.
Yeah.
Totally agree.
Well, let's go to some of these questions in the chat box. Let's see. Odessa asked, I've had COVID for 3 weeks and still see symptoms off and on. Can you elaborate on the so-called long haulers? People have been experiencing symptoms for extended period of time.
Yeah, as you can imagine, there's still a lot about the long-term consequence of COVID that we don't know because it is a brand new organism, and the effects on the human body are wide and varied. We have seen patients that have both prolonged positive tests as well as prolonged symptoms. I would certainly say if the symptoms worsen, then they obviously need to re-seek healthcare and make sure it's not something else. But it is not terribly unusual for us to see prolonged symptoms upwards of certainly 2 to 3 weeks is within a pretty standard, normal trajectory for COVID.
And if someone still doesn't have their sense of taste or smell back after several months, I mean, you recommend them reach out to their physician or ENT or.
I would. We also have seen prolonged loss of taste and smell. So again, it's probably not the bell curve, but certainly any prolonged symptoms past, I would say, 3 to 4 weeks, they probably do need a revisit. Just to make sure that it's not something related to COVID.
Yeah. Joseph, who's a restaurant owner downtown on the peninsula, asked, he's concerned about lifting capacity restrictions and could this cause a spike? We all recognize the governor's order here as of this week. I think it's important that people feel safe in every establishment that they visit, obviously. And opening up to fuller capacity. Is there something y'all want to elaborate on or things to watch out for and best practices, that sort of thing?
Sure. So regardless of your capacity, making sure that you're doing the spacing as well as you can, really keeping that social distancing between tables, more maximizing any outdoor space you may have. Again, are those mechanisms, regardless of what the capacity limitation is, that can be very, very beneficial. You can check your HVAC system. You don't want to be recirculating the same air repeatedly. So if you have the ability to pull in outside air or increase that, do such. Really be diligent about your cleaning, especially of the tables and surfaces used by customers. And then, mask wearing. From what I understand, I think the mask requirements are still in place coming and going from restaurants. And then staff, make sure your staff are wearing them and that everybody's setting good examples, covering their mouth and their nose with them.
Thanks for that, Dr. Traxler. Brian's got a question about the vaccination process. He says it seems to be rushed, and he wants to know, how can we be certain any vaccine will be safe and effective? Are there any suggestions or recommendations you have for people as a vaccine comes online on speaking to their primary care physician, or how do people go about that process in order to have a sense of ease about having it?
Yeah, and I touched on that a little bit, but it really does get back to the FDA approval process and making sure that there's as much due diligence with the COVID vaccine as any other, vaccine that we've released in the U.S. And making sure that post-vaccine surveillance period is sufficient duration to make people feel, that not only is it effective, that it's going to protect you, but that it's safe from significant, adverse events.
Right. I think is exactly as Dr. Scherer said. There's the FDA is taking, and they've come out and said they're committed to taking all of the precautions they usually do. The independent board, the independent data review board will still be reviewing the data before even this information goes to the FDA, for them to decide whether to give an emergency use authorization or to approve it. And so, So I trust that process. I think that they are very committed to doing it the same as they do for all the other life-saving vaccines.
Brian's got a question. I mean, he says, how concerned, he asks, should we be with Halloween just a few weeks away with regard to COVID-19 and children trick-or-treating door to door? He asked, what are some recommendations to keep children safe? Obviously, a lot of parents wondering the same thing as we near this holiday. Y'all have any suggestions to add to Brian's question?
So sure. So I think avoiding large groups, if your children are going to go trick-or-treating, avoiding large groups of children out together is one big thing. Certainly, if you can figure out a costume that incorporates, a face mask, and that is great. If you're the one handing out candy, really trying to make them into little bags, or you do the candy dropping into their pails rather than having, however many different little hands coming in and reaching through the candy. But there are alternatives to trick-or-treating that people, should consider, particularly this year. Doing scavenger hunts where people are more spread out, going through a maze where there aren't many people around you. So the CDC has some great ideas, and they list them by, lower risk and then increasing risk. So if you go to the cdc.gov/COVID-19 page, they have a Halloween section that has some good advice.
Okay, excellent. Thank you. Let's see, we got a question from Sharon. Hold on. Now, Melissa asked, understanding that one may be contagious before a COVID test is positive, what are the recommendations for when family come to visit so we can feel comfortable in our homes? I guess in that waiting period for when a test is coming back.
I think sharing indoor spaces is always going to be a risk. I do think it has become kind of standard practice that people do get a test. So for example, if they're traveling out of town specifically to see family, many families do elect to have a test, prior to their arrival to give them some additional reassurance, especially if they're going to a family member that has significant comorbid conditions or advanced age.
Yeah.
And so that, but a negative test, as we stated earlier, does not 100% of the time rule out the possibility of COVID. So even with family visitation, as much as is feasible and reasonable, we still do recommend, the 6 feet, social distancing, mask wearing, hand hygiene, trying not to share common space as much as, again, feasible and reasonable, knowing that we're all still trying to live our lives and coexist with COVID. Sharon's lost 4 family members to COVID. It's just terribly tragic, and our hearts go out to Sharon. And she mentioned she's concerned about testing sites seeming to decrease. And can you touch base once again on the status of testing capacity overall in South Carolina for Sharon?
Mm-hmm. Sure. So I'd say that testing has not been easier or more accessible before in the state. I mean, it's, as Dr. Sharon mentioned earlier, we are committed. We are working with partners. MUSC is taking the lead in this testing plan that DHEC is also involved with, and other partners. We're committed. We have at least one mobile or pop-up site in each county each week, and the larger ones have even more than one. And while some of those numbers fluctuate very much, others, which are what we call our static sites, which include not only hospitals, but other labs, other just facilities that have a routine standard presence or for testing, those numbers have been increasing. And so there's more access to those testing. In terms of the capacity, DHEC is partnered and is contracted with 4 different outside labs within the state to increase even just our labs capacity. So not only taking our labs from 500 to over 2,000 tests a day, but we've added on thousands more available per day through these contracted labs that are contracted to also get results back within 48 hours.
And so they just wanted to find out real quick where the nearest testing site for them on that particular day. You're saying go to DHEC's website and and they'll find that information there.
scdhec.gov/COVID-19 testing will take you right to the testing site. You can filter by city, county, all that.
Okay. All right. Robin's asking about specific guidelines regarding percent positive for schools to remain open and the metrics. She says there's a lot of uncertainty regarding safety for teachers and their staff, let alone students and their families as well. Can y'all speak to what metrics are in place right now as it relates to the schools, and is that set by Superintendent Spearman or in coordination with DHEC, or how's that?
So DHEC does put out some information on recent disease activity levels by county, which are a set of metrics, looking at 3 different ones, kind of a low, medium, and high. These are not intended to be used as a standalone. These are not to be directive in terms of, the schools must do or should do X, Y, or Z based on that. It's one piece of the puzzle that we recognize there's a lot of factors that that the local superintendents and school administrators have to make, have to use to make their decisions. And so those metrics are available out there, and then one of them does include percent positive, but it is not, as I said, is not DHEC saying whether schools should be open or not. It's one piece of the puzzle.
Okay. Ben's got a question on how we combat messaging that tries to lessen the seriousness of COVID-19. Ben, it's a great question, and something that, in this day and age where people use Facebook, Twitter, social media for so many different things, so many people are also going there for their news and their information. And while sometimes that can be a good thing, so many times false information is spread pretty quickly as well. I think it's important that you recognize the source of the information, back it up, and I think Dr. Traxler, you probably say CDC, DHEC. These are the tried and true, trusted sites that brokers in objective facts and science, and can cut through the political rhetoric. But it's important that kind of go straight to the source in those regards, and especially before sharing something on social media, be sure that it's accurate, reliable, and truthful, because as we've seen, just the spread of disinformation can set us back significantly. I don't know if you want to touch on that, Dr. Traxler or Dr. Schur.
I totally agree.
I agree too. Yes, please. Everybody do their part in sharing accurate information. And yes, CDC, DHEC, even MUSC's website has good information. I've gone to theirs. So all of those sites are good, objective, factual info.
I know that a lot of local news organizations do a good job of putting out resources too, and letting people know where there'll be pop-up testing sites and things like that. Susie's got a question on and we talked a little bit about this earlier with flu season, the impact of having a flu shot on the likelihood of getting COVID, whether or not there's any, insulation there, or what we know about the interaction between a regular flu shot and COVID. Can y'all speak to that?
I mean, I think we can probably safely say, to our knowledge, there's no reason to believe that your risk of COVID would go up or down with a flu shot, that there's no reason to believe, from an immunologic perspective, that should increase or decrease your risk of acquiring COVID.
I agree.
Okay. It's good to know. Let's see. Sharon is concerned about cruise ships returning to our port, and ask whether or not DHEC is setting out guidelines. From my understanding, there's been that no sail order had been extended as of recently. I don't have the date handy on when that expires, but can you speak to whether or not DHEC, I think it's January, extended through January, but January 2021, is there any involvement with DHEC as it relates to, especially in our backyard here in Charleston?
Sure. So we have worked even before when cruise ships were still coming into port, when this was beginning. We worked with the port authority, the cruise ships, and the CDC's what we call their Division of Global Migration and Quarantine, which handles the travel aspects, to assess if there was any need, if there was any risk, particularly increased risk associated with those folks coming on board. And we'll continue to collaborate with those partners when the ports do open back up, and help provide, guidance and also assist. I know also MUSC was excellent in assisting with that when we had some cruise ships coming right before the ports closed down. So we appreciate their assistance since they were there right in the backyard.
Dr. Sure, anything to add on that, or?
I mean, we stand ready to be helpful. Obviously, cruise ships have been a known source of super spreader events. I don't think there's anything controversial about that statement. So I think we should steer clear for the foreseeable future.
Yeah, pretty safe that congregations in large numbers during a pandemic is a bad idea. I think I don't think we need many more experts to tell us that. Thanks for reinforcing that notion, Dr. Sure, Dr. Traxler. This has been very helpful for so many of us, and I want to thank you all for your time, for jumping on here and helping us navigate some of these most common questions that our office has been getting. And we've put our phone number, our local office number out there. If somebody is having any trouble, they're more than welcome to contact us. We're willing and able to help out in any way we can, whether it's regarding the economic impacts with unemployment, or with on the health concern side with PPE, etc. So we're located obviously Mount Pleasant, down Beaufort as well. So if you have any questions at all, we're also online cunningham.house.gov. Our office number here is 843-352-7572, and the website is up there. Kaylin just put that up in the contact box. And again, I just want Dr. Traxler, Dr. Sure, thank you so much for all the things you provide to our community, your service, and helping us navigate this pandemic. I want to wish both of you all well, and to everyone who's tuned in. Hope everyone stays safe and healthy during this pandemic. And thank you all so much again for joining us. I appreciate it.